Hello, and thank you for joining us today. We're just going to wait another minute or so for the other attendees to log in, but while we wait, we're going to play our Being Well Together film.
Interested in the well-being of your organization? Do you find it difficult to know where to start or how your existing well-being offering is working? We have worked with experts to create holistic well-being solutions suitable for organizations at any stage, including our unique Being Well Together program, the integrated solution for all your health, safety, and well-being needs. Our research indicates that only 49% of companies have a written well-being strategy, and most of those do not measure effectiveness. Our range of solutions help you to identify gaps in well-being provision, providing clear guidance on how you can address them. Becoming a supporter of the Being Well Together program means access to tools and resources, allowing you to effectively develop and implement a health, safety, and well-being strategy in a joined-up, holistic way. You will see the health and well-being of your workforce improve and make the most of your investments. The Being Well Together program is available from British Safety Council or Mates in Mind, both registered charities.
Hello, and welcome to our Being Well Together webinar entitled How to Present a Real Business Case for Workplace Wellbeing. My name is Natalie and I work for British Safety Council and our Being Well Together programme, and I'm delighted to be introducing this event this lunchtime. Research shows that integrating health, safety and wellbeing together into a strategy makes both financial and business sense. At British Safety Council, we're passionate about helping organisations like yours to do just that, and we want to help you put wellbeing at the heart of your organisation. Through our Keep Thriving campaign, we aim to help improve the wellbeing of workers within and outside of the workplace so that all of us can thrive. Please do see our website for more information on this campaign. As part of the Keep Thriving campaign, we ran a series of free in-depth workshops for SMEs led by Head of Wellbeing at British Safety Council, Herbert. And it is with the insights and findings from these workshops which Marcus will share with you today in his presentation. Capturing the needs, challenges and future plans of each organisation who has attended has allowed us to better understand the real business case for workplace wellbeing. This session will also consider the necessary factors for the design and implementation of a successful wellbeing strategy. Before we begin though, I wanted to let you know that due to the number of attendees for this webinar today, everyone except the speaker will be on mute during the event. However, Marcus welcomes your questions, and so if you have any questions or comments as we go along, please do note them into the question box on your panel and they will be answered at the end during our question and answer session. If you wish to tweet or post about this event online, please do use the hashtag #BeingWellTogether or hashtag #KeepThriving. And should you need to leave the event at any point, don't worry, we will be sending out a recording afterwards. I would like to take this opportunity now to introduce our speaker. Marcus Herbert is Head of Wellbeing for British Safety Council. With over 15 years of experience and 2 degrees in the wellbeing industry, Marcus has worked with individuals, elite athletes and executives on enhancing their own personal wellbeing and reducing their risk of lifestyle diseases through effective behavioural change strategies. Transferring this experience into the corporate setting, Marcus has worked with organisations from micro to global on their approach to organisational wellbeing and how to develop an effective and meaningful wellbeing strategy. More recently, Marcus has developed training courses to support directors, line managers and employees on the most effective ways to embrace health and wellbeing at work. So over to you, Marcus, for more.
Great, thank you, Nat. I appreciate the introduction. And for those that are attending, if you've been involved in our monthly webinar series for the whole of 2023, then welcome back. And if you're new to this webinar series, then welcome to you as well. And if you have attended these sessions before, you'll know that we normally bring in a guest speaker to come and talk about their experiences with wellbeing within the workplace. And they're usually from different sectors or from different backgrounds. And the whole point of these webinars is to share what we recognise as being best practice. But for today, you're stuck with just me, as opposed to having a guest speaker. And we wanted to share some of the insights that we've gained from these workshops that we've delivered at the end of last year and the beginning of this year. And then the reason why we've put together this particular topic of how to present a real business case for workplace wellbeing is off the back of some of the findings that we gained from delivering these workshops. So I've broken down the session into two key areas. First of all, actually just giving you a little bit more insight into what those Keep Thriving Wellbeing Strategy Workshops were actually about. Giving you a bit of insight into who attended those sessions, giving you insight into some of the data that we collected prior to the sessions being delivered, and also giving you some insight into some of the data we've collected after the sessions have been delivered. And then finally, giving you a bit of insight into where we currently are with the workshops and what the next steps are for us. And then the second part, very clearly, is although it is related to the findings from the workshops that we've delivered, it is in isolation what we hope to be some useful information for you as an audience or you as an individual of the factors that need to be considered when putting together a business case for workplace wellbeing. I will be answering the question as well within that second half. Why is it that we should even have to create business cases for workplace wellbeing? As Matt said, there are opportunities to ask questions at the end, so feel free to pop those in the chat function and I'll hopefully be able to answer them as best I can towards the end. Okay, so the Keep Thriving work. We have the Keep Thriving campaign, which is at the moment one of our key campaigns as British Safety Council, as a charity. And the Keep Thriving campaign is all centered around workplace wellbeing. We have published a Keep Thriving manifesto, which gives more insight into what our aims and objectives are of that campaign, as well as a wellbeing positioning paper. So you can check out this information on the website. You can have a look at the manifesto, have a look at the positioning paper as well, to see whether or not it's something that if you haven't already signed up to, then of course the website is the way to do that. And this particular piece of work was something that we identified towards the end of 2022. We're having internal conversations around what is it that we can do to help organizations when it comes to workplace wellbeing. And we were looking into which organizations currently have a wellbeing strategy in place. And what we found was that it was the larger organizations, so those that have employees of over 500 staff, seem to report having a wellbeing strategy in place. So over 70% report as having a wellbeing strategy in place. Whereas those that are of a smaller size, so less than 500 employees, seem to be reporting, I think it was around about 30% actually highlight that they have a wellbeing strategy in place. So we identified that as our target, and we wanted to help those that are considered to be SMEs within the UK of how we could help them with the concept of creating a wellbeing strategy. So we put together these 3-hour workshops. I'll give you a bit of insight into what we actually covered within those workshops. But we didn't just want to offer those workshops out for free to anybody. We wanted to offer them out for free, but we wanted to offer them out to people that actually had a specific reason and need to attend these workshops. So we put together an application process with an assessment criteria as well. So not everybody that applied for these workshops were able to attend one of these workshops, but I'll give you some data insight into how many actually came through. We also have an evaluation of impact. We didn't just want these workshops to be something that people could attend and say, you know, it's a nice thing that I've attended, thank you for having me. We want these workshops to actually have a measurable impact. And so at the moment, we are going through the process of capturing what impacts those workshops might have had 6 months after the workshop. But obviously, based on the timing, we're only in the early stages of collecting that data. So there'll be more on that, more than likely in future Being Well Together events. And then also those that attended the workshops, we will be hosting a roundtable event later in the year, where only those that attended the workshops will be able to be invited. And again, it will be an opportunity to bring those individuals together to start talking about shared learnings and areas for support that are continually needed. And the reason why we put these workshops together, as I've mentioned already, we want to have some form of measurable impact. But it was really to help the organisations that report of being lacking in resources when it comes to workplace wellbeing. We wanted to use them as an opportunity for each organisation to share their learnings with other organisations as well. And that certainly came through in the feedback that people particularly appreciated, understanding that they're not alone in the challenges that they're facing. And they were actually able to identify some of the solutions to some of the problems they highlighted just by hearing about other people's experiences. We really wanted to put across that well-being, when you're talking about well-being through a health and safety lens, really well-being, health and safety should be considered as in a holistic way. And rather than completely separating them out into areas of specialism, if you bring them into a single conversation, there are learnings that can be taken from those that are traditionally responsible for health and safety and those that are traditionally responsible for well-being. And then another objective we had was to provide ongoing support. So we wanted individuals to sign up to the Keep Thriving campaign, become supporters of the Keep Thriving campaign, but also those that attended, that also participate in the 6-month post-workshop review, have also been invited to apply for a pot of funding in order to spend on improving the well-being of their workforce. And so we're just going through that process at the moment. And so a little bit more information about who actually attended these sessions. Well, we had 216 organizations apply, and having gone through the assessment criteria, only 199 of those were deemed to be successful to be put through and invited to the actual workshops. And then, although all 199 were invited to attend workshops, of those 123 actually attended, and we spread those out over 20 virtual workshops between November and March of this year. And looking at the types of people or the types of positions that actually attended these workshops, the top 3 positions were company directors, HR managers, and health and safety managers, which is much to what we were expecting, to be honest, based on generally who reports as being responsible for well-being in the workplace. But that is just kind of high-level insight into these positions. Once we've gone through this full piece of work where we've captured the post 6-month survey and we've completed the roundtable events as well, we plan to do a deep dive analysis and really have a look at what have we achieved as an organization, but also what more support can we provide to organizations in the future. And I'm sure that if you are one of the people that didn't attend the workshops, then you might be wondering, well, what exactly did we cover in these workshops? 3 hours is a long time to be talking about well-being in the workplace. Well, you might be pleased to hear that the workshops weren't just us talking at the attendees. It was very much conversational workshops, but we were guided by these core principles that are on the screen at the moment. We did spend a fair bit of time talking about actually what is well-being. How do you define well-being? How does that then relate to health and safety? And then why is managing well-being so important within an organization? And what we found was that although people attending these sessions were fully already quite aware of how important it is to manage well-being in the workplace, there were many differences in how people defined well-being. So across all of the workshops, we found that there were multiple different definitions that could be explored. We also, within the workshops, had a bit of a breakout session to talk about how many organizations are actually getting it wrong at the moment when it comes to workplace well-being. But that isn't through bad intent. The organizations that are currently investing in well-being for the workplace have the absolute best intent to support the employees. It's just that the execution isn't in line with what a strategic approach would be. So it's easy to point the finger to say organizations are getting it wrong, but I don't want that to be considered to be a negative commentary. It's just highlighting how there's a difference between taking a strategic approach to well-being and just having an intervention approach to well-being. Another area we spoke about was actually the difference in roles and responsibilities. There's a lot of attention at the moment on the importance of line managers and the impact that they have on well-being within the workplace. Of course, that was a key area that we discussed. But we also explored the difference in responsibilities for the individuals within companies, and then also the decision makers, the directors, the people that actually create the wellbeing policy. Naturally, throughout the entire session, the whole theme of these workshops was to talk about how to take a strategic approach to wellbeing. And some of that I will be discussing in the second half of today's webinar. And so we'll be able to touch on some of those at a high level. As well as talking about data and evaluation, again, these are things that I will be talking about later in today's webinar, and giving you some of the examples that we explored within the workshops. And then, of course, understand the importance of engaging people and communicating the message. We spent a fair bit of time talking about these areas because, of course, having a wellbeing provision in place that nobody knows about isn't good to anybody. So we spent a fair bit of time talking about these key things as well, particularly because they often are the failing point of wellbeing interventions. So let's now have a look at actually the people that attended. What were they reporting as their key challenges before they actually attended these workshops? Some of this data that I'm going to be sharing with you now actually formed part of the assessment criteria. So when we were asking organizations, essentially, why is it that you want to be able to attend these workshops? We asked some of these key questions as well to understand what are their current needs, to see how we could build that into the workshop delivery itself. And what you're looking on screen at the moment is just the top 5 themes that were picked out of the data for what challenges they were currently facing when it came to the well-being of their workforce. And as you can see, stress, burnout, and mental health, top 2 reasons. You potentially could actually group those into the same grouping as opposed to being separated out. We've decided to separate them out just for clarity of data. And then you could see that the other top 2 areas were engagement and culture. And then lastly, considering that we started capturing this data towards the end of 2022, that COVID actually still came up as one of the key challenges that companies are facing when it comes to the well-being of their workforce. Now, I don't think that'll be a huge surprise that stress, burnout, and mental health were considered to be the key challenges when looking at well-being of the workforce. When you look at the reasons for absence from the workplace, more often than not, stress and mental health feature in the top 5 reasons for absence. So another question that we asked was, if you are currently trying to support the well-being of your workforce, what have you done before? What is it that you've tried before? And were there any kind of success outcomes found as a result of what you tried before? What you can see here is the vast majority of organizations that completed the survey data said that they had actually tried some well-being interventions and they were capturing some measures of either success or not success. Then the second biggest answer was nothing to date. So these organizations have a desire for supporting the well-being of their workforce, but as far as they're aware, they haven't tried anything that would enhance the well-being of their workforce. Now, when I say as far as they're aware, I'll expand upon that a bit more when we're talking about what well-being actually is, when it comes to the workplace anyway. Then 15% said that they tried interventions, but there were no success measures, so they didn't know whether or not what they tried was successful or not. Then 13% said that they have a plan but no strategy, and then a small percentage said that they have a strategy but no plan in place, which does tally up quite well with our pre-workshop data analysis, where we found that SMEs generally are reporting that they don't actually have a strategy in place. Then when we asked the question, why do they think that they were facing those particular challenges? Maybe again, unsurprisingly, that the top reason for, or the top reason they think that they're facing these challenges was that they felt that there's not enough time. Again, that is consistent with other data capture when you have, when there's other research outlets that have looked at what are the reasons why wellbeing interventions or wellbeing strategies fail. More often than not, one of the top reasons is not enough time. But very close to that was low employee engagement, followed by then changes within the business, which, I guess when you consider the last 3 years, all organizations, the changes they've been going through, especially with the makeup of the workforce as well, and that's understandable in the current workforce. Then 15% lack of budget and 9% reporting that it's a new business, so they haven't yet reached a mature wellbeing strategy. And this next question I found particularly interesting. I'll come on to the exact reason why I found it particularly interesting. But we asked what would help them overcome these challenges. And the thing that I found particularly interesting is the lowest percentage, or the least occurring response was at the very bottom of the screen. You can see on the left-hand side that only 3% felt that having a better understanding of their staff would help them overcome the challenges that they're currently facing when it comes to workplace wellbeing. This was before they'd attended the workshops. And one of the key points within the workshops is learning to understand the needs of your organization is one of the starting points of putting together a wellbeing strategy. And we're going to touch on that again in the second half of the presentation. But anyway, coming back to the top reason, what do they think would help them overcome the challenges? Well, yeah, the majority said learning how to develop a strategy they thought would help them, followed by actually making wellbeing integral to their business plan, both of which were areas, of course, that were considered within the workshop. So it's good to know the workshop that we've created to help these people was actually addressing the areas that they felt would help them overcome the challenges. Knowing more about best practice was the next top reason. Then ability to measure and assess wellbeing initiatives. What we found in these workshops was that people wanted to be able to assess the effectiveness of wellbeing initiatives, but didn't really know how they could assess the effectiveness of wellbeing initiatives, and wanted to know more about what are the different types of ways that you can actually determine success for wellbeing initiative. So we'll touch on some of that in the second half. And then 14% said that if they could actually get financial help to try out new ideas, they felt that that would help them to overcome their challenges, which kind of links into the second part of this project of those that attended the workshops being able to apply for funding to be able to support the well-being of their company. So then, after we'd actually delivered these workshops between November and March, we initially sent out a survey just to capture the initial thoughts. Of course, it's impossible to capture whether or not there's true impact of the workshops until after time has gone by and they've been able to take those learnings and apply those to their challenges. But we wanted to, of course, capture what they thought of the workshops. How would they rate them? Did they think that they were useful? Were there things that they would change about them? And of course, we wanted to understand whether or not attending the workshop had actually enhanced their understanding about what good wellbeing strategy looks like. So first of all, we asked the question, does your organization currently have a written wellbeing strategy? And as you can see from the data there, that the vast majority, 70%, said no, we don't have a written wellbeing strategy. Then under 20% said yes, and just over 10% said other. But what I wanted to do is just share with you, for those that selected other, rather than selecting yes, no, or don't know, you can actually see that in the comments where they specified, you can see that the majority of these comments, you could quite easily position those as being a no response rather than other response, because they've said things like following the workshop, we'll be looking at writing one. That means it doesn't exist at the moment, so they need to write one. They said things like not yet, but in development. So again, technically their wellbeing strategy doesn't yet exist, but of course it's in development, so that's a promising thing. But regardless of that, as you can see, the majority of these 123 organizations that attended the workshops reported of not having a wellbeing strategy in place. So, of course, the question where we've asked them, did attending the workshop enhance your understanding of what good wellbeing strategy looks like? We were really keen to see whether or not they actually had an impact. And thankfully, 90% of the attendees said yes, it's enhanced their understanding of what good wellbeing strategy looks like. And then again, when you come across to other, you can see that when you look at the detailed responses, although somebody has selected other rather than yes, you can see that in their text to specify, they've then put yes with an exclamation mark in capital letters. So they could have quite easily selected yes there. But then they've expanded to say that it actually gave them some good groundwork on how to approach assessing what we have and what we need in order to develop a strategy. So really, really positive outputs from just attending the workshops alone. But of course, we're not just interested in what they thought of the workshops, we want to know whether or not they had an impact in the long term. So there is a bit of a what's next scenario. Firstly, a lot of the people that attend these workshops have already highlighted that they're willing to share their experience and outcomes, which aligns with one of our objectives under the theory of change work, to share case studies of experience and best class experience. And of course, we have multiple formats that we can share these findings. We have our safety management magazine. We have this webinar series, which of course we're presenting on today. And we also have hosted previous roundtables with some of our existing customers. We have our sector interest groups for those that are part of our British Safety Council membership. And we did also first present on this data in our Wellbeing Conference in April this year. And we do plan to report on the further findings to our Keep Thriving work later in this year and beyond. And as I mentioned towards the beginning as well, we do have the roundtable event that we're planning on putting together, which will be exclusively for those that attended the Keep Thriving workshops, so that again, we can further capture what they actually took out of the experience and what their extended needs are. But then when going into the deep dive of all of this data, and there was a lot of data to analyze, we were very lucky that so many people applied to attend these workshops. When we were looking at what are the reasons for investing in workplace wellbeing, there did seem to be maybe a slight misunderstanding of awareness, and so many of the people that were saying the reason why they're attending the workshops is because they need to figure out ways in which to influence those that are the decision makers. So I've referred to purse string holders here, but it might not necessarily be those that own the budget. It might be different areas of influence or decision making within an organization. And when we put all of those comments into a report to review, there was over 5,000 words of reasons. Bearing in mind that's a simple question, what was the reason for investing in workplace wellbeing? There was plenty of detail that was provided. And so that led us on to then putting together this presentation today, where we're talking about, well, how do we prepare a business case for workplace wellbeing, especially if it isn't just for the person that works within finance that is the decision maker. Which leads us into the second part of the presentation today, which is really how do you present a business case for workplace wellbeing? And much like we did with the workshops, the first place you have to start when you're considering how do you invest in workplace wellbeing, you need to make sure that you understand what wellbeing means to you within your organization. As I've referenced earlier, there are multiple definitions of wellbeing that exist. The British Safety Council has their own definition, which is that well-being is an individual's ongoing state which enables them to thrive. So two key parts there. It's an ongoing state and enabling them to thrive. So well-being isn't really something that you achieve and then you have and the box is ticked. Well-being is a transient state. It can go up, it can go down, and there's multiple factors that can have an influence on somebody's well-being. However, if you were tasked with putting together a business case for investing in workplace well-being, you might find it difficult to put together a business case based on just this statement alone. It's quite philosophical. I do like it as a definition, but by itself wouldn't make it easy to put together a business case. So one of the points of information that we refer to when we're talking about wellbeing in the workplace is the domains of wellbeing, which was originally put together by the CIPD. And this is an adapted version of their Wellbeing at Work report in 2022. And what this shows within the 7 domains of wellbeing is there are multiple factors that are present within a person's working life that have an impact on their well-being, but more often than not is not connected to somebody's well-being within the workplace. What we find is that more often than not, when organizations are talking about well-being in the workplace, they're generally thinking about 2 of the domains here, or maybe 3 actually, but 2 key domains keep coming up, which is health in the top left, and then good lifestyle choices on the bottom row. Usually because when people are talking about well-being, they refer to things like physical health and mental health, and actually more recently financial well-being as well, which is the 3rd area I said that some organizations are referring to. But then actually, if you come up to the top row and you come into the middle of the top row and you can see good work, it does actually make a lot of sense when you break these down that things like the working environment or the actual quality of the line management or whether or not the individual has autonomy within their work role, it's quite easy to identify that all of those factors would actually have an impact on somebody's well-being within the workplace. And so what we could start to think about actually is when we're putting together a business case for investing in well-being, maybe the primary focus of that business case is to look at the actual working environment. Coming across to values and principles, you can see that inclusion, diversity, ethical standards, and of course leadership, all of those come into the conversation when you're looking at well-being in the workplace. So again, rather than looking at putting together presentations on resilience or putting together some benefits that help to address healthy eating in the workplace, maybe the focus needs to be on supporting the leadership of the organization on how to be good leaders. Coming down to collective social, looking at employee voice. I referred to the data that we captured as part of the Keep Thriving work, that only 3% of organizations think that getting a better understanding of their workforce would actually help them overcome the challenges that they're facing. But actually, just by capturing the employee voice alone, even if you did nothing with the information, which I highly wouldn't recommend, but even just capturing the information alone and getting to understand what the employees' needs are within an organization, by itself can have a positive impact on their well-being. Naturally, if you are able to act on their opinion and do something about it, of course, that's going to have a more beneficial effect. And then coming along to personal growth, and good lifestyle choices and financial well-being, again, you can see that there are key areas that exist within a person's work life that will have an influence over their well-being that often are not connected to the workplace well-being conversation. And so when it comes to the question of, well, why should we have to put together a business case in the first place? Surely investing in well-being is just the right thing to do. Surely every organization just recognizes they should just be supporting and looking after their employees. But it's not quite as simple as that. Although there are some organizations that simply have a CEO or a CFO or somebody in a high position of influence that believes well-being is really important, and they have healthy budgets to invest in well-being, there are many organizations that will ask the question, why should we invest in well-being? And so, of course, two core reasons as to why having a business case for well-being does actually make sense. One is it helps the organization as a whole understand what the actual options are. What would the cost be in terms of actual outlay financially? What would be the cost in terms of time? And then what are the opportunities that could be lost or gained as a result of investing in well-being? That, of course, can all be reported within the business case. We'll be expanding on how you could do that later in the webinar. And then secondly, it actually shows the decision makers that there is a clear project plan and rigor behind the courses of action. So it's not just that one person has attended a webinar on the business case for workplace wellbeing, thinks that it's a good idea, and then is asking for spend in a certain area within the company. It actually shows the decision makers that there is a process that needs to be followed, and that there is a plan in place to consider if things don't go to plan, then this will be our backup plan. But I actually, in looking at how to answer this question, why should we have a business case, I came across this imagery, which I thought it did make me laugh, but there is some truth to it, from the book Organised Wellbeing by Marsh and Ward, asking the question, what has wellbeing ever done for us? And the response here, obviously jokingly, but also raising a good point. Okay, fewer of our best staff are leaving, a reduction in absenteeism and presenteeism, more creativity, discretionary effort, productivity, and a better reputation, granted. But apart from that, what has wellbeing ever done for us? So it allows you to identify, actually, here are some of the benefits of investing in wellbeing, and they align with what our objectives and needs are as an organization. So before you get to the point of actually documenting any form of wellbeing strategy, or even presenting a wellbeing business case to the decision makers, I'm of the belief that you should be able to answer all of the questions that are on the screen at the moment, or at least fill in this table that is on screen at the moment. I consider these to be prerequisites to even documenting, creating, and presenting any kind of business case when it comes to workplace wellbeing. And part of that is understanding the past. Where have we been? What have we done in the past? What have we tried? How much money have we spent? What were the impacts? Did we measure the success of anything that we did? And if we didn't, you're starting to highlight actually what are some of the gaps in what you've done in the past. But you need to have a clear understanding as to what has been done in the past to improve well-being within the workplace. You need to have a really clear understanding as to what you're doing at the moment to support the well-being of the workforce. And then crucially have a vision of where you should go as an organization and why. Many times when we're talking with organizations about their well-being strategy or their well-being plans, when we ask them what their vision is or what their mission statement is, many organizations don't have the answer to those questions. And so if you don't know where it is you want to take your workplace well-being, it becomes very difficult to put together a business case to support what you're trying to achieve if you don't know what it is that you want to achieve. And then also there should be some core values that act as the guiding principles of the work that you're planning to do and how you operate. And this could actually link in with existing core values that you have as an organization. And you may well find that actually the core values you have as an organization are already quite closely related to improving well-being of the workforce. Secondly to this table, and moving down to the second table, again, a major factor that is often missed from any business case or any wellbeing strategies that we've reviewed is actually looking ahead and considering what are the potential obstacles that we could face that will prevent us from realizing our vision. And any good strategy will consider what could go wrong so that we have a plan B in place to react to when things go wrong. If any of you attending today's session have ever put together a wellbeing business case or put together a wellbeing strategy, you'll know that even if you have the perfect plan and the perfect strategy and you have unlimited funding, things still can go wrong in that process, and so using that experience and planning for it will help with, of course, presenting and getting the business case signed off. So then what I wanted to do when I was putting together this session is just share a very basic template of how you could actually position your business case, or how you could initially start your business case, or even actually giving you a template that you could use to essentially fill in the gaps to be able to then document the business case before it's presented to whoever the decision maker is. And I say whoever the decision maker is because there is often an assumption that when you're putting together a business case, it's to secure funding for investing in well-being, but it might not be to secure funding. It might be to secure time, or it might be to secure change within a work design. And we'll come on to that later into the slides. This actual business case template is a free template. I actually just took it from a website called Miro. You can see in the bottom right the logo of the company. It's just a simple business case template. I've just slightly changed it to be relevant to well-being. And there are plenty of other free resources where you can put together business case templates. And these cover the 9 key areas, kind of linking into the prerequisites of what you need to have written down and defined and determined before you then present your business case to whoever the decision maker is. And what I've chosen to do for the rest of this webinar today is pick out some of these key areas and expand more on some of the considerations when you're looking at, well, what is the actual problem? And what are we presenting as the possible solution? What is our start point? How do we know what it is that we need to do when it comes to the well-being of our workforce? Then determining who actually are the stakeholders. How do we know who the decision makers are and what are they motivated by? Again, we're going to be expanding upon some of this in more detail. But again, like I said, you can use these free templates and it asks the key questions to give you guidance that if you are able to answer these questions, it will help you with presenting the business case to the decision makers. So starting with that first point, what is the problem? Now, the starting point will vary depending on your organization. If the starting point is that there's been a single suicide in the workplace and the primary focus of a well-being business case is to prevent suicides in the workplace, you can see that that is of much higher importance and should be a focal point versus coming down on this important scale of, say, educating a workforce on optimal well-being or supporting an already thriving workforce with their well-being. So if the start point is prevention of suicides in the workplace, then all time and energy and funding should be dedicated towards prevention of suicides in the workplace. But of course, if there are no suicides in the workplace, and actually it's that there are a number of serious injuries in the workplace, and then again, reducing or preventing serious injuries in the workplace should be the primary focus. So that should articulate what is the problem, what is your actual starting point. Now, the starting point might be as simple as just, we want to reduce the amount of illnesses that are caused by the workplace, or we want to prevent the amount of time that is spent being absent from work because of stress within the workplace. But you need to understand what is your starting point, and everything needs to be focused around that, rather than trying to improve everything when it comes to workplace well-being. There needs to be a focal point, and you need to understand what your starting point and problem area is. Once you've got a clear understanding as to what your starting point is and where you are with your kind of maturity of workplace well-being, you need to have a clear understanding as to actually who are the decision makers, who are the people that we need to convince for supporting this business case, or maybe signing off this business case for well-being. It might well be just the finance director. That might be the only person that needs to be convinced, but it might not be. It might be the HR department. It might be health and safety. It could actually just be the overall managing director. Maybe it's all of them. So what can you do to influence those individuals? Well, the best way is to find out what are they motivated by. And so I've actually put together those 5 key areas that I just referred to: the HR team, health and safety, finance, and then also operations and the exec team. And I've identified some examples of what those different departments may well be motivated by. So if we take the HR department, they may just be motivated by having a healthier, more inclusive culture. Health and safety might be motivated by preventing fatal injuries within the workplace. The finance team might be motivated by just purely return on investment. operations team might just be looking to attract the best talent, and then the exec team might just be looking at how do we increase productivity within the workplace. Well, all of these things that I've put on screen are not here as just coincidental examples. All of these areas have got research to back up that when an organization puts together a wellbeing strategy, then all of these factors are found to be outcomes as a result of putting together a wellbeing strategy. So it would be very easy for you as a person putting together a business case for workplace wellbeing to pick out examples of where organizations have found that by investing in workplace wellbeing, we have seen these outcomes which align with what you as an individual or you as a department are motivated by. So it will help you achieve your objectives within your part of the organization. So finding out what they're motivated by, finding out who the decision maker is, using the data that exists quite openly and freely in the market just through simple searches, and you'll be able to find evidence of how a wellbeing intervention or an organization that has used a wellbeing strategy has found these outcomes. So then moving on to the question of, well, how do you know whether or not your wellbeing intervention is going to be successful? And this was an area that I mentioned earlier on in the webinar, that many of the organizations that attended didn't know how they could identify if wellbeing business cases have been successful. More specifically, wellbeing interventions have been successful. And so what you can see on screen is just very simple, high-level examples of what data could be used to evaluate the success within a wellbeing business plan or wellbeing business case. It could quite simply just be the percentage of participation rates within the organization of things that are put in place to support the well-being of the workers. It could simply just be looking at crude data of the number or the percentage of absence within the workforce. But then if you're able to go into that data in more detail and have a look at actually what are the reasons for absence as well, and how often are they occurring, again, this could be used as a data point for evaluating the success. You could be looking at the health and safety data, the number of incidents or accidents, or even just the number of injuries that have been reported within the workplace, or you could look at reasons for leaving data. All of these are just examples of how you could evaluate the success of your wellbeing business case. But I would not recommend that you use any of those unless you've identified that that is a specific area that you're trying to target with your wellbeing business case or your wellbeing business plan. If you've identified that one of the key areas that you want to focus on is a reduction in health and safety incidents, then you should use that as a way to evaluate the success of your wellbeing business case. But you shouldn't be looking at other areas or other metrics of success if they don't relate to what you're trying to achieve as an organization. I also wanted to share with you some more specific examples or specific sets of questions that exist that can be used to report on the outcomes of wellbeing interventions. But again, what I want to show you here is there are multiple ways for you to have any kind of data capture on the impact of wellbeing interventions. You won't struggle to find ways to assess whether or not it was effective. But again, a key point that I must reiterate, that you shouldn't be looking to use these for the sake of it. You should be looking to use these metrics for measuring wellbeing based on what it is you're trying to achieve with your vision and your mission statement. And bringing us into the key messages as we come towards the end of this webinar, broken down into 5 key areas. As I've mentioned, within this webinar, if you can clearly identify those prerequisites, that's going to really help you to then document your business case. It's going to really help you to understand actually who are the decision makers within the organization. And then, of course, when you understand who those decision makers are, really clearly understanding what are the key factors that they're motivated by, and then can you find evidence and data to support that investing in workplace well-being is actually going to help them achieve their objectives within the organization. Naturally, you need to be able to document the specific business case based on the needs of the organization, which very closely relates to capturing the employee voice. And then lastly, wellbeing strategy is not something that can just be documented in a policy and then followed and just shared on an intranet site. It's something that does require project plans. If you have a wellbeing strategy combined with a project plan, you will find that that will ultimately result in more success with the wellbeing business case. And although putting together a business case, rolling it out, assessing whether or not it was effective, changing things that weren't effective and evolving based on the ever-changing need of the organization, it does take time, it does take energy, but as Warren Buffett once said, someone's sitting in the shade today because someone planted a tree a long time ago. So it is worth the time and energy for the future. So as we bring the session to a close, if you've attended these sessions before, you'll know that we do offer a free 30-minute complimentary consultation with one of our team to discuss the wellbeing needs of your organization. So if that is something that you think that you would benefit from as a result of attending our free webinar today, then take out your smartphone, scan the QR code on screen, fill out your details after the webinar, and we'll be able to reach out to you and have that conversation. As I said, it's a 30-minute complimentary consultation, or you can just take a note of the number and the email address on screen, and feel free to reach out to us and we'll be more than happy to help. And then of course, this is part of our ongoing monthly webinar series, so keep an eye out for our future webinar, which will be delivered in August. And that brings us to the questions and answers. So if there have been any questions submitted, then I'd like to welcome Natalie to join me back to let me know.
Hi, Marcus, I'm here. Well, thank you. First of all, I just want to say that was a really insightful presentation and I loved your slides. I think you laid out our findings and suggestions perfectly. We've had just a couple of questions and we will just answer them quite quickly because I'm aware we're a minute or so over our kind of allocated end time now. So the first one's from Salam. He said, what are the measures, and this actually came in right at the beginning when you were talking about the organisation's kind of pain points in the survey. What are the measures that the companies reported studying from their wellbeing programs? Were they simple feedback and engagement measures, I think surveys, or did they assess valuable wellbeing metrics?
Yeah, so it's a good question. Obviously, I did kind of touch on some of this towards the end of the session itself, but most of the organisations didn't know how to report on the outcomes of their wellbeing initiatives. You know, within the data, it showed that the majority of people were putting interventions in place, but they had no measures of success. So that wasn't even considered to be a thing that should be included when rolling out a wellbeing intervention. It was, we just have this available and the staff can access it. It wasn't, is this addressing our current need and are we finding success because of this initiative? And so just that alone, if organizations started to do that, they would help to improve their understanding of, you know, putting together a wellbeing business case.
Yeah, it's quite important to identify the right starting point, isn't it? I think, and once you're there, I think everything kind of, you know, flows from there. The second question, which is quite a quick one, and it's in British Safety Council's special interest groups, is the message reaching the small construction companies? So this person says, it's sorry, Mary actually, who's asked this question. I've observed at first hand how the only member of a wrecking crew who was wearing PPE was the youngest trainee. Now, obviously, that broadens out. I mean, that's health, safety, and well-being. I mean, that is, you know, we're talking about it as a sort of holistic view of all three and how they work together. What are your thoughts on that? I think the message is obviously broadening and getting out there. What do you think, Marcus?
Yeah, I mean, there's a lot of work to be done, and unfortunately, when it comes to workplace well-being, more often than not, the focus is on, well, what's new and what's next, rather than actually what we've done so far. Is that working? Is that addressing the needs of our organization? Of course, what you can see from these workshops, we've specifically targeted the SMEs. We recognize that that is an area, you know, within the UK workforce that has a higher need, which is why we've focused those Keep Thriving workshops on it. But obviously, because British Safety Council have been supporting organisations of all sizes in health and safety and well-being for the last 60+ years, it's something that if organisations of that size are needing support, they can reach out to us, and it's something that we can most definitely support with.
Yes, indeed. Well, I think that was it for the questions today. So that just leaves us to say a big thank you to everyone who attended the session today. We will be sending a follow-up email to everyone with a link to the recording. Obviously, we'd love your feedback. There will be a survey straight after this webinar today. Big thank you to you, Marcus. That was really fascinating, really interesting to hear the findings from those workshops and the kind of the post-workshop surveys that went out, and looking forward to hearing much more about it all. So it just leaves me to thank Marcus. Thank you again for joining us and have a wonderful day. Thanks.